for that presentation. Is Mr. Van Eenoo back on the line?
Yes, I am.
Okay, did you want to go ahead and start your presentation? Sure.
If I could ask the IT folks. The title of the presentation is HHS Council Committee Presentation. There it is. So I'll try to go through this quickly because in various settings, I know you've seen these slides before, and I know you have a lengthy agenda. If we could go to slide number 2, this is just to provide you with a real quick update on our budget picture where we started prior to COVID-19. We actually...
And I'm sorry, if I can just interrupt you. Just real quick, if anybody's watching, this is item number 2. Go ahead.
Sorry for that. Yep. But this was our picture prior to COVID-19, facing a 3.5% revenue cap imposed by the state. Nonetheless, we were projecting a balanced budget for FY21, but we did have some gaps in the out years we were projecting. But at least our short-term picture looked pretty good. Next slide, please. And then COVID-19 hit, and we had to essentially shut down large portions of our economy to stop the spread of the disease. And this slide is showing the impacts on our general fund revenues that we're projecting for fiscal year 20 and 21. It's impacting our sales tax collections, mixed drink taxes, user fees and fines for different charges that we assess for participation in rec programs, library programs, and then interest earnings, all down significantly from what we had forecast. We did a rapid resolution and a slower resolution scenario. Right now, we are actually timing-wise, we're on that rapid resolution timeline in regards to things beginning to reopen, but we're continuing to focus in on the slower resolution. We just don't have enough data to have a real good sense for how quickly our revenues are going to rebound. So out of prudence, we are continuing to plan for and anticipate the slower resolution revenue impacts, which would be $57.6 million less revenue than planned for fiscal year 20 and $22 million short for fiscal year 21. On the next slide, please, that the revenue consequences are not only about the general fund, we're also seeing significant declines in our hotel occupancy taxes, airport revenues, and often transportation department parking fees. If you look at the sum total of those various revenue drops on these two slides, you're in the neighborhood of $200 million less revenue in the budget coming into the city to pay for city programs and services than what we had been anticipating. On the next slide, the next 3 slides really, we start showing some of the actions that are already underway or that are potential options for keeping our budget in balance and for managing through this financial crisis. We quickly implemented a hiring freeze on all non-essential positions that currently applies to more than 600 positions across the city. Departments are scrubbing through their budgets to reduce any discretionary budget line items as they can. Right now, we are conservatively projecting $14.4 million of savings through these 2 efforts. Conservative meaning that I expect we'll be able to beat the $14.4 million, but we always want to be conservative when we're at the early stages of our planning process. We're also doing a lot of work and had been doing work even before COVID-19 as a result of the 3.5% cap to look for ways to improve our operational efficiencies, reviewing our various social service contracts related to homelessness services, aligning our programs and budgets to strategic direction 2023, and pursuing additional general fund revenue options. Those things had all been underway prior to COVID-19, and we're still doing work on those in those areas as part of our FY21 budget planning. On the next slide, these are some of the assumptions that had been in our financial forecast back in when we presented the fiscal year 20 budget to council last year. These were the assumptions we were making about the future, and all the items in red here, given our current financial picture, drops in revenues, we're going to have to revisit our forecast assumptions, things like employee wages and our ability to fully fund the capital replenishment fund how many officers, and the timing of opening up new fire stations. All these things need to be reconsidered in light of the change in our revenue picture. And then on the next slide, these are some additional options that are available to us, and then all these pieces of the puzzle have to come together somehow. But we do have the ability, despite some recent comments from the governor, we still continue to feel the statute is pretty clear and that we have the ability to go up to 8% tax increase over the next 2 years, pursuant to the governor's disaster declaration that's allowed in the new state law pertaining to how we set tax rates across the state. Looking into the number and amount of the fee waivers we offer as a city, our reserves, we started the year with reserves more than $25 million above what our policy level was. So that is going to help us get through this, and general fund reserves are going to be part of the solution for how we navigate through these difficult financial times. And then finally, the federal funding picture is starting to clear up a little bit, but through FEMA and the CARES Act, specifically the Coronavirus Relief Fund, we're going to have the ability to pay for a portion of the expenses the city is incurring related to our COVID-19 response. On the next slide, just really quickly on the budget process, I want to focus in on the community engagement because that's the focal point of your conversation today. But it was back in January, February, and into March is where our boards and commissions were doing a lot of work looking into the budgets of the different departments, working with the community to get input and crafting recommendations to city departments about the FY21 budget process. On the next slide, you'll see that our 9 equity commissions that comprise the Joint Inclusion Committee, they each hosted a budget equity forum. You can see the dates and locations here. And then pursuant to those equity forums, they got together and crafted their recommendations pertaining to the budget. On the next slide, you can see across all of our boards and commissions so far, we have received a total of 79 recommendations on the FY21 budget, with 26 of them related to our strategic outcome of health and the environment, with economic opportunity being the other big area for recommendations, with 21 recommendations pertaining to that outcome. On the next slide, then, we take those recommendations and show you how they were assigned to different departments. So we get all these recommendations in from the boards and commissions early on in the budget process, and then we assign them to the appropriate departments. And in some cases, a recommendation may be broader than a single department, and so we'll assign recommendations to more than one department as appropriate. At the very bottom, you can see at Austin Public Health, they had 23 total recommendations that were assigned to them to review that were relevant to their services. We asked the departments to look into the recommendations and to give us feedback, to let us know if they feel the recommendation is something that they support, something that they can accommodate resources, perhaps it's something they already are providing, or if it's a service that would require additional resources for them to be able to implement. And that is really the other part of the backup that we sent you this morning is the listing of those 23 recommendations that were assigned to Austin Public Health Department. And we bring that up really quickly. It's the second file for our IT folks. It's called BNC Recommendations to APH. And it's just a PDF document that lists the name of the commission. There it is. I won't go through all of these. There's 23 of them in total. That lists the name of the commission, provides a brief summary of what the commission recommendation was, gives you another brief summary of what the department's response to that recommendation was, and then we actually included in the PDF document a link to the specific recommendation itself, whether it be a resolution or some other format that the recommendation came to us in. We provided a link to the source document. That's all I have for you. I'd be happy to answer any questions, and I think we have staff from Austin Public Health on the line as well if there's any questions about the specific recommendations or their responses to those recommendations.
Any questions, Councilor Rotovo?
Thank you, Mr. Van Eenoo. I have a several questions. I guess my first is really for public health. So let me ask the other ones and then I'll circle around. Is the budget question and answer open yet? And if so, or if not, when will it be open?
We can open it right here, right now. If you have a question for us, I think we have not had our first question posted this year, but we are certainly ready to stand that process up.
That's great. I do have a couple.
All right.
Submit. I am interested, on page 5, you referenced revenue ideas that are under review by law. And this probably isn't the time or place to discuss them, but if there are some that would be appropriate to review in an executive session, I would be interested in knowing a little bit more about what some of the initial thought is on those. I do have a question about hiring freeze on non-essential positions, and this is probably better for the budget Q&A, but it is both a COVID-19 question and a budget question, and that is, I'm really trying to get a better sense of what is the situation impacting our temporary employees, and we have temporary employees across the city, and so getting some real concrete understanding of what the plan is right now for those employees and what the plan is moving into the next budget year would be very helpful. And then my last question, I think, is one for public health, and that is about health inspections and health fees. My office was contacted by a couple different businesses about their health inspections and health fees. They were receiving, for example, renewal notices during a period of time where they were closed. And so I wonder if there's somebody on the line. We got the answer we needed for that constituent, but I wonder if there's a staff member online who could just provide information about two things related to that. One, why businesses might have been getting a renewal during a period of time when they were not allowed to operate. As I understand it, those renewals happen at different times for different, say, restaurants. And so when they initiated the application, we'll determine when they're slated to renew it. And if you could also just verify my understanding that with health fees and inspection costs, inspection fees and other costs associated with those kinds of applications, the City of Austin is not making money. We're just covering the costs. Hopefully, we're just covering the costs of the staff and administrative time that's required to implement them. And so those are two questions: one about the timing of those renewals, and two, just to verify my understanding that that we're charging customers what it costs us to provide that level of service. This is, of course, both of those are concerns for businesses that are really struggling now. And so I think it would help to just have you all on the record answering those questions. And if those are more appropriate for the budget Q&A, happy to submit them there if there's not the appropriate staff on the line.
This is Stephanie Hayden. It would be better to submit those during budget Q&A because I did not bring that information with me to answer those specific questions. But we typically really try to be very close to the cost of service. We hadn't historically gone over the cost of service.
Great, thank you so much. I will submit those, Director Hayden.
Are those all your questions, Councilmember Topo? Okay, Councilmember Kitchen?
Thank you very much for that spreadsheet. I am wondering if we can get, or if you have created a similar spreadsheet for the other departments that we could access.
So we do have, we are working on this for all 79 recommendations we received from all the different boards and commissions. We don't have that department response piece quite done yet for all of them, but as soon as we do, we can send that to the entire council.
Yeah, I would like to see that, even if you have, I mean, we get those recommendations. It's just that, we haven't put it in a spreadsheet. So it's really helpful to have a spreadsheet like that. And even if you don't have all the responses yet, or even if it's going to take some time to get the responses, that would be something that'd be useful to have. So thank you very much.
Sure thing, and I don't think it's going to take long. I think we'll be able to get that spreadsheet to you certainly this week with the department responses.
Okay, thank you very much.
Just to be clear, this presentation was just for our regular budget. This wasn't about CARES, right? I guess there was mention of it.
Yeah, I do not have just one bullet point. In terms of the posting language?
Yeah. That's okay. That's okay. We have a whole call meeting on Friday or Thursday or something. Does any body want to make an action motion? I think, Councilor Kitchen.
Oh, I was just going to kind of follow up on I know we've gotten some boards and commission recommendations related to the COVID funding, or COVID specifically. So I don't know. So Ed, do you have those recommendations available for us for Thursday?
I think we can. I mean, we do have the list of the recommendations, and we have been categorizing them if they're specific to COVID-19 response. So let's work on that as well. I think we can get that to you before Thursday.
Okay, I don't want to create it's very hard to be ready for Thursday. So, but and I don't really care what formats it's in. It's just helpful to have a list.
Yes, we can do that.
All right. Thank you for that presentation, Mr. Van Eenoo and staff.